So I'm sitting here with Steve Davis, and Steve was a doctor in the military for 28 years. He did a lot of health planning, including pandemic preparedness and response, and he lives in Scone. So I thought he's a great resource for me to sit down and talk to and explain some of the things that people have heard about coronavirus and explain why the government's saying certain things and how to help protect yourself and your family from the coronavirus. So one of the first things is a lot of people are having confusion about if it should be 1.5 metres that they stay away from people or 2 metres. So to start with, what's the infection control advice and why?
Well, Liz, thanks very much for having a chat. The main thing here is staying away from people. So initially some of the advice was 2 metres, but as we've learned more about the virus, we've established now that the guidelines are 1.5 metres. With the particle transmission, the virus is quite a large virus. So when people cough, it usually extends out to about 1 metre because the droplets fall away. So it's been established that 1.5 metres is a safe distance from people.
Yeah. And look, I worked with public health, and there are people who actually test this out, don't they? They get people to cough and sneeze and measure it, and they get people of all different shapes and sizes with all different velocity of coughing and sneezing to measure that it is 1 metre.
They do. And slow motion or time-lapse photography during a cough, you'll actually see the spread of the droplets.
And so, but some of the droplets can spread further, but the virus, because it's heavier, I think it's about 5 microns, they know drops basically because it's heavier, so it drops within that 1 metre.
So there's lots of variables. So depending on the virus or the contagion, different distances may be required for those, depending on a whole range of factors. But we've established that 1.5 metres is a safe distance.
Yeah. So the 2 metres, where do you think that came about from?
There was some initial talk about keeping 2 metres apart, but it's also, I think, stemmed from the room requirements that have been established.
Yeah, I think that was like 1 person for 4 square metres, and people somehow took that to be 2 metres.
Possibly.
Yeah. Now, if somebody is running past you and has coronavirus, a lot of people are concerned about someone walking past within that 1.5 space. What kind of risk does that actually pose?
Well, there's a couple of factors there. I think firstly is the actual chance of that person walking past you or running past you. Having coronavirus is likely to be low.
Yeah.
And then the time frame that they're actually in your space is also very small, so that the chance of them coughing or expressing or the virus is going to be very low as well. So the risk is very minimal. So
you shouldn't really get stressed out too much about someone walking past you.
I wouldn't be stressed out about it.
No. So, and also the 1 metre, that means if someone is coughing or sneezing, that it can spread within that 1 metre diameter around them onto surfaces and things.
That's right. Yeah. And we've seen that different surfaces, the virus can live on different surfaces for various amounts of times. I think on plastics, it's about 2 days.
Yeah.
Other surfaces less. So, that's why it's very important in all of our environments, our work environments, our house, to keep things clean.
Yeah.
To limit any possible transmission.
And even though it can survive on a surface for a set amount of time, again, those studies are kind of done in a lab to test how long the virus can be on certain surfaces. But then there's a lot of ways that the virus can be denatured too, like sunlight and things like that.
There's a lot of factors. So exposure to sunlight, UV light, but I think the main point is that just keeping surfaces clean.
Yeah.
And good old soap and water does the best job.
Yes, we've done a video on that one, on why soap and water is better than hand sanitizer and why you still really need to use detergents in the house. And if you want to use disinfectant, that's a bonus.
Yeah.
And I guess coming into your home too, as long as you're washing your hands as soon as you get home, you're breaking that chain of infection from coming into your house in the first place.
That's right. So if you've been out and about, down shopping or exercising, and you may have come in contact with other surfaces, then when you come home, wash your hands, change clothes, and that'll minimise your risk of contaminating your home environment.
Yeah. And in terms of the contact tracing, I guess that's a good example to show what the risk factors are for being in contact with somebody, because a confirmed contact is somebody that you've been within a closed space for and spent more than 15 minutes with. So it's not just somebody walking past you in the supermarket.
That's right. So, it's hard to know who walked past me in the supermarket or who you actually came into contact with. So a confirmed contact is somebody that is known to have the coronavirus and that you've had, an exposure period in their presence. Yeah.
Okay, excellent. So I think that covers that question, and I'll continue to ask Steve questions and continue to post videos.